ATOMIC is the first randomized phase 3 trial, the only randomized phase 3 trial looking on the benefit of immunotherapies in MSI-H or dMMR colorectal cancer in stage 3. So it's adjuvant treatment, and the ATOMIC trial has been randomizing between FOLFOX as standard chemotherapy alone or FOLFOX plus atezolizumab in patients which have undergone resection of their primary tumor and have, let's say, stage 3 disease. ATOMIC trials results have been presented last year. They are for me, super impressive. The hazard ratio of for disease-free survival has improved by 50%, or in other words, the hazard ratio is 0.50 when atezolizumab is added. And this has become a global standard of care. But now, however, and that's what we presented here at the ESMO GI, is we looked on the relative contribution of chemotherapy and immunotherapy in terms of treatment duration. And we have analyzed patients which had the full course of treatment, let's say 6 months of chemotherapy plus atezo, followed by 6 months of atezolizumab, versus those which terminated treatment earlier. This was not part of the protocol, but it was done. And we may also have the feeling that some patients with a low-risk situation may not need such a long chemotherapy. So therefore, the analysis of these of 600 and whatever patients, 610 patients in these two groups, those which underwent the whole treatment course versus these more than 100 which had a kind of shortened treatment course, revealed that patients which had the full treatment course had the biggest benefit. And that's somehow surprisingly, because we always questioned the relative benefit of chemotherapy, and the general thinking was maybe less chemotherapy is enough for these patients. Well, we do not know. This has not been a randomized trial. This was a retrospective analysis that's exploratory only. But however, we have learned that these patients which had the full course of treatment had more benefit from the addition of atezolizumab than those which had only a shorter chemotherapy treatment duration. So therefore, that's hypothesis generating. The hypothesis is, does immunotherapy in this setting maybe need chemotherapy to be more efficacious? But this, of course, other trials have to prove in a prospectively planned way.